Let's talk again about capsulectomy in women with breast implant illness, which is now currently called SSBI, or Systemic Symptoms from Breast Implants. I've done a few videos in the last couple years going over various studies that have shown that capsulectomy at the time of implant removal does not increase your chances of getting better. So women with breast implant illness are no more likely to improve if their implants come out with the capsule or just the implant alone. Now, this study did a few different things. So first of all, this is a prospective cohort study. So they have two different groups in the study. They have a group of women with symptoms from their breast implants compared to a group of women who do not have symptoms from their breast implants. Now, in addition to comparing these two groups, they also compared the women with breast implant symptoms to women in a prior study that was done. So a prior study that was done several years ago looked at women with breast implant illness who had their implants removed, and they compared whether they had a full capsulectomy or a partial capsulectomy. The reason for the partial capsulectomy was that they were doing testing on the capsules of these patients, looking for heavy metals, autoimmune markers, that kind of thing. What they wanted to do now was compare patients who had implants removed but none of the capsule removed. So that's what this study accomplished. The women in this study had their implants removed alone. So they did nothing to the capsule. They didn't do any suturing. They didn't remove any part of it. They left the entire capsule as it was and just removed the implant. So what we know now, looking at this study and multiple prior studies, is that there's no reason to remove the capsule. Every single study that has looked at this has shown that implant removal alone has the same percentage of improvement as implant removal with the capsule partially removed or with the capsule totally removed. So since there's no difference, there's no reason to do that additional surgery. Another interesting thing shown in this study, which has been shown in several studies before, is that women with breast implant illness are much more likely to get medical information from social media and breast implant illness groups in compared to the women without breast implant illness. They're more likely to get information from their doctor. And this, unfortunately, is one of the things that has been driving women with breast implant illness to get surgeries that they don't need, because these surgeries are often recommended in these groups, and they have a recommended list of doctors who perform this surgery, which is typically called an en bloc capsulectomy. That's not actually what it is, though. It's a total intact capsulectomy, where they remove the implant and capsule in one piece. And I just want to reiterate, there has never, ever, ever been a single study that looked at taking implants and capsules out that has ever shown a benefit over just removing implants. Not a single one. So all of these en bloc experts that have published series, their percentages of patients that get better are no different than the percentages of patients in these other multiple studies that had no capsule removal. So why are they still doing it? And I think the answer, again, is obvious, because it's financially lucrative for them. There are explant experts, and I'm doing quotes because they're not experts, who are removing implants for cash pay. That is the only thing they do, and they often brag on social media that they do $400 to $500 a year. So they're charging cash to patients for an unnecessary surgery 400 to 500 times a year, and that should be alarming to all women. Now, yesterday I put up a video about how our antibiotic use has changed in plastic surgery as the evidence has changed. And the same thing should be happening here. When we know better, we do better. And I think if you are a woman with breast implant illness, you should want a doctor who practices evidence-based care and is pushing the field forward to get better options for you. You shouldn't be going, in my opinion, to these people who are ignoring multiple studies showing that what they do is wrong. So women deserve accurate evidence-based information when making decisions for their bodies. They don't deserve fear-mongering, they don't deserve pseudoscience, and they don't deserve doctors that hide from the evidence to make a buck off of them.